Link, and I'm going to be moderating our webinar today. Okay, so before we begin, I would just like to acknowledge that we are in Mi'kma'ki, the traditional and unceded territory of the Mi'kmaq people. We are all treaty people who benefit greatly from the shared resources of this land, covered by the treaties of peace and friendship. So just a couple housekeeping items before we begin as well. This session will be recorded and it will be available on our website after the fact in case you'd like to refer to it. In terms of mics and cameras, we ask that you mute your mic and turn off your camera during the presentation. And lastly, in terms of questions, please use the chat function if you have a question that comes up in the midst of the presentation that you'd like to ask. We will be monitoring that chat box throughout the presentation. There's also time set aside at the end for a Q&A. And at that point, you can unmute yourself, turn on your video to ask a question if you so desire. So I'd just like to provide a very brief summary of Child Safety Link for those of you who aren't familiar with our organization. We are an injury prevention program at the IWK, and we are dedicated to reducing the incidence and severity of unintentional injury to children and youth in the Maritimes and also at the Atlantic region where appropriate. Child Safety Link is committed to working with community organizations, governments, and other partners to ensure that children are as safe as necessary at home, on the road, at play, and at school. So our at-home work includes things like poisoning and falls prevention. Our on-the-road work includes things such as child passenger safety and pedestrian safety. In terms of at play, we look at things such as helmet safety, concussion prevention, and ATV safety. And finally, our at school work is quite new and it's still evolving, but we are aiming to address all of our topic areas specifically within the school context. So in terms of a little background about this webinar series, this November will mark Child Safety Link's 20th birthday. We launched Child Safety Link on November 20th, the International Day of the Child. And in order to celebrate, we decided to host this webinar series in order to highlight the importance of child injury prevention, as well as to promote the work that Child Safety Link is currently doing. So in terms of our presenter for today, we have Dr. Tina Atkinson with us. Thank you so much for joining us, Dr. Atkinson. Just to provide some brief information, Dr. Atkinson is a sport medicine physician who has been practicing for 27 years and also has experience in family and emergency medicine. She is currently the Chief Medical Officer of the Canadian Sports Institute Atlantic and Hockey Nova Scotia. She's also the team physician for the Halifax Mooseheads and Hockey Canada's women's national team. She's also responsible for all elite athletes training in Nova Scotia, especially the canoe, kayak, and sailing athletes. She is a founding member of Concussion Nova Scotia, which is an interdisciplinary group working to improve concussion diagnosis, education, and management in the province. So welcome, Dr. Atkinson, and I will turn it over to you. Just give me one moment, I'll pull up your slides here.
Great, thank you, Samantha. And I'm so happy to be presenting and giving you some information today. I'm always happy to do more concussion awareness and education, and really exciting to be talking about prevention, which gets lost sometimes in the concussion conversations. So today I'm just going to go over some prevention strategies and the basic diagnosis and management of concussion.
Great. So Tina, sorry, I just want to confirm that you can see your slides, okay?
Yeah. Yes, I can.
Okay,
Thank
great.
you. Yeah.
Great. And okay, perfect. Here we go.
So, and next slide. Thank you. So just some definitions on what is a concussion. I just put these two different definitions here so you can see that the language is quite, it's quite wordy. There is a lot of controversy over what is a concussion in the last 10 years, I'd say. The CDC definition is there. And the second definition is really one that is used by a lot of the consensus groups that do work on concussion. In my world, as a sport med physician, we use the consensus document that comes out after every international conference, which is every 2 to 3 years. We've missed it in the last, we missed the one that was supposed to happen. So there is one happening coming up very soon in November 2022. And we're looking to see if there's going to be any changes that come out of that document. But basically, a concussion is a brain injury. It occurs when there's an impact to the head or an impact to the body that gives an impulse to the head. It causes the brain to move around inside the skull. We know from lots of different research that this causes a neurometabolic cascade with inflammatory changes, and what results from that is the way your brain works is temporarily different. So I explain to people, that this isn't a change in your brain that you can see on any imaging that we have, that we use currently in regular hospital work. There are some functional MRIs that are being used in research. But when your brain works differently, you will feel certain symptoms or show certain signs. And that's what we're looking for when we need to try to diagnose a concussion. Next slide. So the signs of a concussion when you're observing someone is they can be dazed, look dazed or stunned. They forget what they're doing. They're confused. They can't tell you what just happened. Often they're clumsy and staggering, or they can't stand up. They can't walk properly. They often answer questions slowly. Often don't make eye contact because they're having trouble focusing. Obviously, if someone loses consciousness, then by definition, that's a concussion. And often they just have behavior or personality changes that can be subtle, but they're more irritable, more emotional. And then we're looking for signs of vomiting, which occur, and usually in a concussion settle down quite quickly. But if it doesn't, that's another red flag that they would need to get medical attention right away. Next slide, please. Symptoms of a concussion, what the person feels is often headache. I would say that's in 99% of cases that I've seen, that they had a headache immediately, or sometimes described as head pressure. Often are nauseated, often feel off balance, even if they don't look off balance, or they'll say that they feel dizzy. They often have double vision or just say their vision isn't clear. Light or noise sensitivity is a common one that can occur right away or within the few minutes to an hour of suffering the head impact. They often say they feel slowed down, they feel foggy, groggy, sleepy. Fatigue does not necessarily show up right away, but certainly within the first day, and they can't concentrate or remember things and generally don't feel right. Next slide, please. The differences in children and adults is adults often try to hide concussions, but ironically, the concussion in a child may not be as obvious as in an adult, especially if you don't know that child. So I do recommend that people ask very specific questions to all persons with a concussion, not just children, but especially with children, you need to ask them, do you have a headache? Do you feel sick to your stomach? Do you feel like you're dizzy? And not just the general, what happens in sports often is just, are you okay? Are you good to go? Something very vague like that. That's very easy for the person to say yes. So kids will often be very suggestive. And if you ask them, are you okay? They'll say yes. But you need to ask them the very specific questions and suspect by the incident that happened that they might have a concussion. There is a tool that we use called the Child SCAT-5. Sport Concussion Assessment Tool. It's on the 5th edition. There is one for under 13-year-olds and one for 13 to 18-year-olds, or 13 and up, I should say. So also over 18-year-olds. Basically, that's a set of symptom questions where they rate their symptoms, as well as some balance testing, cognitive testing, concentration testing, and just some general neurologic questions and testing. This will be updated at that next consensus conference I was talking about. So we're waiting to see if there's going to be any significant changes. It is used for the sideline kind of coverage, or when you very initially get a concussion. A lot of people use it in their office, or we've tried to use it in our office as a serial type of test, but it doesn't work very well. There is a learned factor with some of the questions you're asking, but it is a very useful tool for the moment that you suspect someone gets a concussion if they're seen pretty quickly. In children, the other difference is recovery is often takes 3 to 4 weeks before they were completely symptom-free, as compared to 2 to 3 weeks in adults. And in children, we do notice that the return to school, return to learn is a concern, because the cognitive effort that's needed when you get back to school often exacerbates symptoms. So you can often get an adult back to work or back to school sooner than you could get a child back to school, which causes significant problems, as you can imagine, at home and with the school. Next slide. So this is a concussion, just a slide about the concussion recognition tool, which is meant to be used at the sideline or at the moment that someone falls or possibly suffers a concussion. It just gives you a little bit of guidance as to what to look for, when to call the ambulance, signs that they might have a concussion, the symptoms they might have, some memory assessment. It is often used with athletes, and then there's some instructions there. So basically just to help you confirm that there might be a concussion and when to call the ambulance. This is a public document, so anybody can download that and have it with them. So the diagnosis of a concussion is really at first just a suspicion. You know, what we're trying to do with concussion education is give people the tools and the knowledge of what a concussion is and what it looks like and how someone acts, so that you can suspect a concussion and then take that person out of that activity before they hit their head again. For the full actual diagnosis in Canada, this can only be done by a physician or a nurse practitioner. In the world that I work in, a lot of athletic therapists, physios, chiropractors, anyone who covers sports often does make that diagnosis at the sideline or in their office, but it is a suspicion, and then a full diagnosis has to be by a physician or a nurse practitioner. At that point, when they do see a physician or an NP, they should do a history and a physical. You want to rule out a more severe injury and other injuries that could coexist, like a neck injury in their cervical spine, and also identify any ongoing medical issues, comorbidities that they already have. Underlying neurologic disorders, mental health issues are just two examples. We do know a lot more about concussion as far as predicting who may take longer to recover and have what we call a prolonged recovery or persistent symptoms of a concussion. The term post-concussion syndrome is not really used anymore, but those people tend to be or we know that people that have certain issues going into concussion, like ADHD or any mental health issue or a previous concussion, will often take longer to recover, so longer than that 3 or 4 weeks for a child. As well, higher symptom scores at first presentation. So if you see them right away after the injury or within 24 hours, if they have a very high symptom score, that the symptom score is what I was referring to on the SCAT test, but there's also something else called the Rivermead Index that's been used for many years. And it just goes through the symptoms and you score yourself between 0 and 6. And if they have a very high score at their first presentation, that is a sign that they probably will take longer to recover. Any visual vestibular issues, so if the child has a problem with reading because of a visual issue, that's often worse after, or if they have vertigo, if they have a history of vertigo or any other balance issues, that often will be worse after a concussion. The other risk factor that I didn't note here is that there is some research that shows that female gender is an indicator that would put you at risk for a prolonged recovery. Next slide. So the management, this may be different than some people have heard in the past, but we recommend complete rest for 24 to 48 hours, avoiding screens, sleep as much as they need to. I usually say you do regular, just basic activities of daily living and sleep for that 48 hours. And then after 48 hours, there has been a lot of much research, and actually most of it in adolescents and children, that return to light activity is it actually is much more beneficial to recovery than prolonged rest. So in the past, people were told, stay in a dark room, sleep until you feel better, don't do anything until you feel better. And they've done several studies, Canadian studies, that showed that the children and the under 18-year-olds, the adolescents, actually had higher symptom scores after their prolonged rest than when they started doing activity after 48 hours. So what I mean by light activity is just going for a walk for 15 minutes, possibly going on a stationary bike if they're an athlete that has a high, is already very fit. They always want to start doing something right away. So a walk outside for 15 minutes is what I mean by light activity, as well as gradually exposing them to screens and other activities such as noise, a little bit of reading, some time on their phone, some time on the computer. Often what is sort of misinterpreted at this stage is that they feel like they've been told they can go back to everything, and that's definitely not what I mean. But it is important to start moving around, get your brain used to some of the sort of stimuli that we encounter in life, and then a very slow progression depending on what you can tolerate. Some people can tolerate it very well and their symptoms will gradually go away. So just to be clear, I mean, they still may have symptoms of concussion, but it is still recommended that they start doing some light activity. At this point, after 48 hours, I want to get them on a good sleep hygiene pattern as well. Often sleep is impaired because they're in pain from their headache, they're worried. There's many reasons why their sleep could be upset directly from the concussion. And then it turns into sort of more of a habit of sleeping too much or not sleeping enough or not sleeping at the right time. So I try to address that really quickly after the concussion so that the sleep in itself doesn't start to cause other symptoms. And as a guideline, the return to physical activity and cognitive activity should be gradual. It has to be individualized based on the symptoms that the person is presenting with, because every concussion is different, and how much activity they can tolerate. I do find that children and adolescents who are very active and fit will tolerate the return to physical activity guidelines better than a child who might be more sedentary. But we have to reassure them that this is safe. You obviously don't want them to do any physical activity that they will hit their head again. So it has to be something just basic, like start with walking. So I will show you the return to learn and return to play protocols. But these are the guidelines that, every 24 hours, there's an increasing amount of activity. And we often end up doing them in parallel. As far as return to play, that if a child's in a sport, then there are specific guidelines for that particular sport. Return to play also just indicates return to regular activity, like gym at school, outside activities, any recreational activity. We do that at the same time as return to learn, but the return to learn has to be fully complete and they have to be back in school before we would let them go back to finish the final step of the return to play, especially if they play a contact sport like hockey or basketball or anything where there's contact or incidental or otherwise. So the return to learn has to be completed before they fully get back to their sport. Next slide. This is an example from Parachute of the return to school. So it just shows you cognitive and physical rest for 24 to 48 hours. After 24 hours, if their symptoms haven't significantly increased, they're either the same or better. They can go to the next step, which is the light cognitive activity. And it gives you examples there of what they're able to do, like easy reading, limited TV. It just all depends on what makes them feel worse. Some people can tolerate TV and others can't. Some people can tolerate scrolling on their phone, others can't. And then you gradually increase at least 24 hours in between each stage. If the symptoms reappear, then you just stay at that stage or return to the previous stage until you can get through the whole up to 4B. Now, there are different different guidelines that you can, they're all basically the same with these different steps, but you can find different ones out there on the internet. New Brunswick Trauma has done this work for a long time, and they have a very detailed one. Brain Injury Nova Scotia, I've been working with Brain Injury Nova Scotia on some Nova Scotia specific ones. They're all very similar, but they just give you a guideline of how you gradually go back. So you can see it would take at least 7 days to get through the full protocol, and they have to be symptom-free, obviously, before they move. They're going to get through the full protocol. Okay, next slide. So for the management, they start the protocols, the return to learn and return to school, sometimes called return to learn, and then the return to activity. I'd like to reassess them every 1 to 2 weeks. At that point, you can see where their symptoms are. If they are starting to, some symptoms are going away, but other symptoms are coming to the forefront, and some symptoms can be treated, such as neck pain, vestibular issues, visual tracking issues. So we want to address any symptoms that are not improving, keep them on the return to learn and return to sport activity protocols. At this point, and actually sooner than this, but I'd like to provide documentation for the schools ongoing, so they are up to date with what's happening. They will be out of school for a certain amount of time. We do try to get them back to school as soon as they're able with accommodations, and that really just depends on the school and what they're able to do for accommodations and how much they understand about concussion or might have experience with concussion in their school and getting a child back to school. So if they have symptoms or they're kind of stalling, they're saying, I'm not improved at all, I feel the same, then there is something else going on that we need to address. Sometimes it's a mental health issue, sometimes it's just support around them that needs to be improved. At that point, if there are specific symptoms that are not improving, we need to address that and refer them to the appropriate practitioner, whether it could be psychology, physio. There's lots of different people that can definitely help. Next slide. This is a graphic that just shows the ideal situation if you to manage acute and prolonged concussion symptoms, an algorithm that can be followed, know when to refer and who to refer to. You can see there, ideally you have an interdisciplinary concussion team. If the child is definitely not improving or there are specific symptoms that need to be addressed. So it's just a good guideline, and we're working towards this in Nova Scotia to kind of build this interdisciplinary team virtually or sort of a team of practitioners that can work together. It takes a lot of communication and a lot of working together, but this would be the ideal situation. Next slide. So if they're not able to return to school, I just briefly, this is what I was talking about when they have symptoms in certain categories. So I'll just go over this quickly. Just to remember that approximately 10 to 15%, sometimes up to 20%, when you read the literature, will say they'll have persistent symptoms. It does seem like everybody knows about somebody who has had a long-term concussion recovery, and it can seem like it's most people at times. But we have to remember that most people do very well when they follow the protocols, but there will be a certain percentage of people, and including children, that will have these ongoing symptoms. The symptoms can often be categorized in this way that you see here in these domains or these categories. There are different categories depending on what you're reading, but basically they fall into these categories and each one of them needs to be addressed. The autonomic dysfunction on the bottom is basically where somebody starts to do an activity and their heart rate increases very quickly. They feel really panicky. They can get sweaty. They just don't feel well. And that is one domain which, if they don't start the light activity right away and do it in a very gradual increase, then this can become quite a problem and last quite a long time. It's very similar to POTS, which is the orthostatic tachycardia that children can get. So one way to avoid this and actually to treat it is to have a prescribed exercise program that takes into account their heart rate and slowly increases their activity level. Fatigue is also one that is very common and often the last symptom to go away and is multifactorial. It's just good to be aware of it and be able to counsel the child and the family that this is part of the concussion recovery and it will get better. Next slide. So to just go over some statistics and information on pediatric concussion that people may not know. In 2016, this is a Public Health Agency of Canada data, 2016-2017, there were 46,000 concussions in Canadian hospital emergency departments for age 5 to 19. Now that is estimated to be over 50,000. There's been a lot of work done by Dr. Zemek at CHEO in Ontario, who suggests that this number is quite a bit higher, and they use data from family doctor, all physician offices and emergency departments that had coded the diagnosis concussion and or head injury. So there's at least 50,000 concussions in now in 2022, 50,000 concussions in that age group per year in Canada. The Healthy Behavior in School Age Children report in January 22 said for the year 2020, in that age group of the grades 6 to 10, 1 in 10 youth have had a concussion in the previous year. We know that more than 50% of concussions occur in the under 19 age group while playing sports, but in boys it was actually 65.4% and in girls 52.6%. As you can see here, where do they occur? Playing a sport, the other 50% are sort of lumped together as far as due to falls, playground, or motor vehicle accidents. But interestingly, 10 to 20% of all head injuries are actually sustained while they're at school. Next slide. So the sports with the highest concussion rates in Canada are ice hockey, rugby, football, and ringette. When they compare participant information or participant for girls and boys in sports where the rules are the same, such as rugby and hockey prior to checking, females actually have a higher incidence of concussion in those compared per participant. Most head injuries, as I mentioned, do occur in the sports setting and athletic activity. The next is at home, and the third would be at school. Next slide. This is just an example. I put this slide in here. This is my personal picture from our World Championships that we had in COVID, where Canada won. We were lucky enough to win the gold medal for the first time in a long time. And, you know, the reason I do this is I want people to be able to enjoy their sport. I want them to get back to their sport. I want them to pursue their passions and, you know, have their concussions treated properly so that they fully recover and hopefully can continue in their sport. Next slide. So for prevention of concussion, so primary prevention, you know, the things that we can do are try to avoid getting the concussion in the first place. We know we're not going to avoid all concussions and prevent all concussions, but important to use seat belts, car and booster seats, as well as well-fitted protective sports gear. So a helmet, for instance, has never been shown to prevent a concussion, but it certainly can prevent a much more severe brain injury. And as we know, if you watch hockey on television, most of them don't wear their helmets properly. So for kids, you know, under 19-year-olds, definitely should have well-fitted protective helmet and other sports gear, just for overall protection, but also for prevention of a worse brain injury. A lot of research is being done on proper training for contact sports. So rugby and football and hockey have actually put a lot of time and work into teaching the children how to properly perform the skill of their sport, which could be a tackle and or a body check or just incidental contact, as there is in female hockey. This has shown to improve or reduce injury incidents, and lots more work can be done in this area. Also, proper supervision for practices and games to try to avoid kids from doing things that are risky, such as, running at each other, something called helmet and gloves that used to happen in hockey dressing rooms, which two docs at the IWK who used to work at the IWK actually did a study and a research paper on, and actually caused Hockey Canada to eliminate, to make that illegal for that to happen in the hockey dressing rooms, because basically they were putting their helmets and gloves on and just having a boxing match and punching each other. So as well, there have been recently in the past, since 2013, body checking in hockey has been was changed from age 13 to age 15. In Nova Scotia, we were one of the first, I think we were the first branch of Hockey Canada. So Hockey Nova Scotia actually changed this rule first. And a lot of this came out of research that was done by Carolyn Emery, who's a physiotherapist in Calgary, who does a lot of concussion research. And she has just released a paper that reinforces that the eliminating body checking has significantly reduced the number of concussions in hockey of the under 15 age group. As well, we can do more concussion awareness and education to just educate everybody around concussion, identify concussion when it does happen. But concussion awareness and education does contribute to primary prevention, as we hope people will follow the rules and use all these initiatives that we know help for primary prevention. We have something called National Concussion Awareness Day, which was September 28th this year, which was interrupted by the hurricane, but it is all across the country. And in Ontario, it's called Rowan's Law Day, which is named after a 17-year-old rugby player who died while playing rugby for her high school team in Ottawa, who unfortunately it wasn't recognized that she had a concussion and possibly a few concussions the week leading up to the day where she played, and unfortunately lost consciousness and then passed away. Next slide. Secondary prevention really is where I spend most of my time educating about concussion and giving people the tools and the information to recognize that this possibly could be a concussion, and they need to remove that person from the play. So that could be a sport, that could be on the playground, that could be any recreational activity where someone might fall and hit their head, skating, biking, anything like that. If the really important thing is, especially for children, which is where second impact syndrome, which is what happened to Rowan, where there is a concussion on top of a concussion that causes global swelling of the brain and is unfortunately a catastrophic injury, that almost always there's almost no, it's very, very rare for it to happen to an adult. It's almost always in children. So we need to recognize that it may be a concussion, and we take them out of that activity and avoid a second concussion on top of the first one. The other thing we can do for secondary prevention along with that is make sure that they fully recover. And the best way to do that is to follow the return to play and the return to school guidelines. Next slide. So this is just a slide to talk about Carolyn Emery and her ongoing concussion. She has numerous concussion research projects going on, and the one that is she's put a national emphasis on, and they actually have a bus that is called the Shred Bus, and they are traveling across the country to evaluate the concussion prevention strategies. So Shred Concussion's a surveillance research project, and she contacted me at one of our national meetings, and I'm hoping we can do something with her in Nova Scotia. Next slide. So one thing I did want to mention is mental health outcomes and issues after concussion. This is as well a very prominent area of research right now. And in that same healthy behavior in school-age children report, the youth actually self-reported that if they had had a concussion in the past year, they were less likely to be satisfied with their lives, more likely to report a lot of emotional problems and overall poor psychological well-being. There are some studies that have shown that there's an increased suicide risk after concussion that was correlated to the concussions that have prolonged symptoms, and especially the mental health symptoms. Concussions, even without the suicide risk, they're associated with poor negative mental health outcomes. Especially if they're away from their friends, away from activities, not able to go to school. They report high emotional problems, often difficulty getting to sleep because of emotional problems, and state that they feel depressed, in a bad mood, or they're nervous. I would say this happens in almost every patient that I see to some degree. Some people seem to, initially when they have a concussion, they often feel like this, and then it improves. But for some, it just doesn't improve, and they start to feel worse and worse and worse. And then the mental health issue and the symptoms that they feel from that really overlay all their actual other concussion symptoms, and it's very difficult to tell, do they still have a concussion? Is this now mental health? Really, when I see patients and parents in my office, at that point, does it actually matter, which is which? But we need to treat their mental health symptoms. And then if you can treat them and get them feeling better, they'll often report that their concussion symptoms go away. Interestingly, the early return to activity helps significantly with this, and is actually has been shown to prevent the poor mental health outcomes. Getting them back to some activity and helping them feel a little bit more like themselves. So just other things that the respondents have reported, just their life is not filled with things that interest them. They're not in good spirits. They never feel calm. They don't feel active or vigorous or ever rested. So these are things that you'll often hear. And when I see concussion patients, especially adolescents, and I have seen a few young kids too, I would say they're kind of stalled. So they're plateaued, they're not improving, they're not getting worse, they're not getting better. You really have to look at this, and often it's the mental health symptoms that are the culprit. Next slide. So this is a picture of when we won the gold medal in Beijing. You can see top of my head here, just above the girls. This is the ultimate goal. Certainly there have been, it's not everyone's ultimate goal, but for these players, and several of them have had concussions. It's not easy to tell someone that you have a concussion if you're in the middle of trying to get to the Olympics and win an Olympic gold medal. And they've had concussions different stages of their careers, and we're fortunate enough to do well and recover fully and be able to continue playing. So that, like I said, I want people to be able to get back to their lives and get back to their sport, if that's, because that's what I do in sport medicine. But really, we need to get people back to themselves. We need to try to prevent another more severe concussion or catastrophic injury. As I mentioned, we want to try to prevent the persistent symptoms and make sure they have a successful return to school and activities that improve their quality of life, and just let them live their life and get back to normal. Next slide. So key messages that I hope you take away from this talk is that we all have a role to play in promoting awareness of concussion. I say we can all be concussion educators, even if you're not sure. What we want people to realize is that it's okay to say, I suspect a concussion, or I think you might have a concussion, and just take those proper first steps. And if they don't, they'll be clear in a few days. But often the athletes now that I see in my clinic, the young athletes actually know more than their parents. They've heard the words concussion protocol. They know that's kind of normal terminology. They know what it means, and they're actually okay with it most of the time. I'm in the concussion protocol, and I'll make sure I'm fine, and then I'll get back to my life. So it's important for us all to learn the symptoms and signs, and also know that symptoms can be delayed. So I didn't talk about this much, but they can be delayed up to a few days. There is debate about whether it can be longer than that. I certainly do see adults sometimes that say they didn't have symptoms right away. In the hindsight, really almost everybody has at least one symptom that they didn't actually recognize. But it's important to know that the adrenaline and just the trauma and sort of emotional aspect of the injury, they may not recognize those symptoms until it's a few hours later or a few days later. I want to encourage everyone to speak up if they feel they have a concussion. This is why I do education for kids and adolescents, and tell a parent, coach, or teacher, tell someone that you think you don't feel right and you might have a concussion. Obviously, we need to know the red flags and when to get immediate help, when to go to the hospital, go to emergency. But I do want people to know how to manage the first few days if they don't have any red flags, because it is difficult to see physicians or nurse practitioners quickly. And you need to know the first few days can make a big difference in their recovery if you do things properly in that first 48 hours. And then start the activity, the very light activity after the 48-hour mark. We should all be aware of and follow the return to learn, return to sport protocols. And for people with concussions or struggling with persistent symptoms or not knowing if this still is a concussion, I want them to know they're not alone and there are resources out there and things we can do to help. Next slide. So this is just the resources that I use. There are other ones. I tried to cut it down so there's not too many. There's several out there that overlap, but we do have them all sort of curated on our Concussion Nova Scotia website, which is now hosted on the Brain Injury Nova Scotia website. So if you only go to one, you could look at that one. The other one that's amazing is the one from Dr. Zemek, which he worked with the Ontario Neurotrauma Foundation on this living guidelines for pediatric concussion. So it's very interactive, and they update it all the time with the best and new information. Next slide. So that's it for my talk. I hope people have questions. I love answering questions and finding out what people want to know. So happy to take any questions now.
Hi, Tina. There are a few questions in the chat box. I can read them to you to make it easier. So Diana's wondering if there's been a move towards mandatory mouth guards in those under 18 when involved with contact sports.
It depends on the sport. For some sports there are. Unfortunately, that's often an insurance issue by the sport because fixing teeth is very expensive. So I would just say you'd have to check with that sports national organization. There is generally a move towards it, yes, but it really depends on the sport.
Thank you. There's another question here. I'm curious about the old saying that you need to wake them every 2 hours on the first 2 nights. They're assuming that there's no evidence for this now.
Yeah, no, definitely don't have to. I worked in emergency for 9 years at Cobequid. And even then that was old advice, but I know it still happens. You know, I have 3 sons, so I get it. You're going to be worried about your child, but you can go in and look at them and make sure they're breathing, make sure, but you definitely don't need to wake them up.
Thank you. In regards to the mandatory mouth guards, do you have any information in particular with hockey?
In hockey, there are mandatory mouth guards in certain leagues and certain levels, and that tends to be the ones that have body contact, or sorry, actual checking. That is mandatory. Yeah.
And another one here, wondering the symptoms of a concussion for children and babies under 5 years.
So those would fall into the symptoms that are not as easy to see, and they're not going to necessarily tell you. It's really observational. So they be sleeping. They might tell you that they have a headache, or they could be acting differently, be irritable, often have kind of a personality change, sleeping more than usual, not wanting to watch TV, not wanting to listen to music, things like that.
Great. And another question here, are mouth guards recommended for soccer?
That's a good question. I believe so. My kids didn't play soccer after they were 10. I would have to check with Soccer Nova Scotia. Generally, I would recommend mouth guards, but I'm not sure if it's mandated.
Tina, I just have a question regarding helmets. I know
Mhm.
there's been, I've seen some specific helmet brands advertise that they prevent brain injury without naming concussion specifically. I'm
Right.
wondering if that's marketing on their end, if you know anything about, or if this new technology is actually helpful.
Yeah, I mean, there's no helmet on the market right now that's been shown to prevent concussions. So that might be why they're not saying concussion, they're saying head injury.
Mhm.
Possibly, we know that all helmets, if they're fitted properly, would prevent a more severe brain injury or head injury, like a skull fracture or something. So I think they're very careful because there's been lots and lots of research, and so far it hasn't shown that they actually prevent concussion.
Okay, thank you. Mallory, do you want to keep reading from the chat or?
Yeah, there is one
Okay,
more that
thank you.
just came in there. No problem.
Okay.
Are there statistics for children under 5 years that get concussions?
Not that I could find specifically under 5 years. So I did look for that. So I know there are groups that are interested in getting more data. We actually don't have a lot of injury surveillance in the sport world in that I work in, which is not under 5-year-olds. We don't actually have really good injury surveillance data, even in the elite athletes. So I know there are groups working on that.
Thank you. Do we have any data broken down by cause in Nova Scotia? So for example, specifically to falls or motor vehicle, etc.?
Not specifically to Nova Scotia. That just this information that I gave you so far, it would be 50% are sports and 50% are everything else. Motor vehicle accidents in the data that I saw that was done, but not specifically in Nova Scotia, was more motor vehicle accidents than I thought, but falls were the second cause.
Mm-hmm. And do we have
Mallory,
any?
sorry, we just have somebody with their hand raised as well. I don't want to skip over them. Um,
Absolutely.
Jen, did you want to unmute your mic? Do you have a question?
Yeah, I was just wondering if if somebody does sustain, a childhood or adolescent concussion, is that something that can last into adulthood, or is it like once they've healed from that concussion, their brain is back to normal? Or like how is it will it have lasting impact, especially if there's like multiple concussions? Like for example, I played rugby as a child, and
Mhm.
I've had many concussions over the span of my lifetime. Is that something that like would still affect me today, or is that something that like once I heal from that concussion, it's done, it's over, and I'm good to go kind of
So it's very individual. So the problem is that some people, so I see a lot of people that, played a lot of hockey, rugby. I played rugby in university as well, and which is actually why I got interested in concussion. And I'd already planned to go to med school, but it was always in the back of my mind that I would do this kind of work. Because I played with many people who were obviously concussed and no one took them out and they kept playing. In those situations, we know that people have had long-term problems where they were not completely healed or didn't recover, their symptoms didn't settle down. There is a lot of there's a lot of unknowns, and that's around, and a lot of work is being done in football because it's driven by lots of money, finances in the U.S. mainly, where they're worried about the subconcussive hits. So someone doesn't have typical symptoms of a concussion, nobody would recognize it, they might not pull themselves out, but they have these hits over and over and over again that are large enough to give concussion. We're actually doing some research at Dal with the Dal varsity football players, and they're wearing helmets with sensors in them. So it's a very individual. I can't give you a response that would cover everyone. What we do know is that there's no magic number of concussion anymore. It has more to do with if I'm going to tell someone that they need to stop playing their sport, it's because each concussion that they get is worse, meaning more severe symptoms and or last longer, or they're getting a concussion more easily. So with a relatively light impact to their head, their concussion symptoms, they get a concussion symptoms right away and they're not improving. So it's really the pattern of concussion. We do know that there seems to be genetic risk to concussion. So there are some families where everybody in the family seems to get concussions. The Lindrosses are an example. And so we don't really understand that. The other thing about long-lasting concussion symptoms is often people tell me they didn't really have the specific symptoms anymore, but they never really felt the same. So, you know, we don't use the term mild, severe, we don't grade concussions anymore. It really depends on the symptom burden and how that person feels. And so do they actually have changes in their brain? We don't know. Lots of research going on with, like I said, the functional MRIs, as well as looking for biomarkers in blood or saliva, and looking for EEG data, any information that we can get to tell if that person's brain is permanently damaged or not. So I know that doesn't specifically answer your question. You know, I think most people, all the people I see are very functional, but I do have a lot of people coming in to me and saying, I really never felt quite right, and I'm worried that I have long-term damage. Sometimes it's because they actually have a lot of regret or guilt around either not following the protocols properly or not knowing about the protocols. There's all kinds of emotional issues that can be wrapped up in that. But if you've recovered from your concussions and you're able to go on and live your life, you know, the bottom line is a lot of people ask me about CTE, and we just don't really know. We know repeated concussions is a factor, but some people have one concussion and then are diagnosed with CTE post-mortem. So, you know, there's a lot of, it's a lot we don't know, and it just depends on the person and their pattern of concussion.
Awesome, thank you.
Tina, do you have any data regarding cheerleading, specifically flyer concussions?
No, I don't. I wish I did. And I'm laughing because unfortunately, I don't see very many cheerleaders. So I'm suspecting that a lot of concussions are either not being reported, or they're kind of dealing with them in the sport. The concussions that I have seen in cheerleading, what I've been told is that there's some pressure to not report because they'll lose their spot on the team. So that's just local. I would assume there would be more information on cheerleading in other places where it's a little more popular, in the US, for instance. But interestingly, when you look at all the research, there isn't much on cheerleading, and I don't really know why that is, but I'm suspecting it's because it's just not reported.
Thank you. Can you speak to why there's not as much emphasis being placed on using mouth guards?
Because there just recently has been some research that's published on mouth guards may prevent a more severe injury, but most mouth guards that people use are not good enough. They're not long enough. So they really need to be a custom mouth guard. And most of the time they're talking about mouth guards to prevent, you know, oral injury, tooth injury, tongue injury, something like that. And I think a lot of sports, they just don't like wearing mouth guards. But there is some new research that actually shows that it probably does helps to prevent a more severe injury. It can't totally prevent a concussion, though. There hasn't been any research to that yet that states that it can actually prevent a concussion.
Thank you. Do you know of any courses that occupational therapists can take to be able to work with this population?
I don't know of specific courses. So there is one training tool from BC. It's CATT. I think it was one of the resources on my slide, but they have training tools. So they're like little mini courses for health professionals, for coaches, for parents, for educators, that are very good. There is another massive open online course that is put on by the University of Laval as well as U of C together, and they'll probably open their next edition of that very soon. Yeah, the CAT training tools. I think within the occupational therapy occupation, though, I have worked with many OTs, so I assume that they have their own sort of internal training.
Perfect. Thank you, Mallory. Is that all the questions in the chat, I believe?
That's all that's there.
Great. Any final questions before we wrap up? Good. Okay, perfect. That was great. Thank you, Tina, so much. I'm just going to quickly share my screen again just to wrap up here. Just bear with me one moment. All right. So I just, again, want to say thank you very much, Dr. Atkinson, for being a part of this webinar. It was extremely interesting, and I can tell that we were all very engaged by the questions, and it's definitely a topic that's, gaining more and more awareness, and it's great to have you come and present at this webinar. So thank you so much. You can find this presentation and the recording on our website in case you need to access it. I'd also just like to take a moment to promote our community of practice. This is something that Child Safety Link is developing. It's going to be an opportunity for open communication and discussion around issues related to children's injury prevention, so concussion being one of those. We're hoping to launch this initiative in November. So if you are interested in receiving more information or if you'd like to join, please email us. I'll have our contact information on the next slide. And lastly, we do have a couple more webinars coming up. So our next webinar will be on the topic of poisoning prevention, and it will be on October 19th at 11 o'clock. So that one, again, will be very interesting. And so please feel free to join us for that webinar. And I believe that is it, folks. So thank you so much for coming and attending this webinar. Here's all our contact information. That's it. Thank you. And I hope you all have a nice day.